Hello, hello everyone. So in this episode, we are going to focus on the analytical errors in the lab. But before that, there is something that I want to talk about in the pre-analytical errors that we discussed in our previous episode. Pre-analytical errors. These are errors that occur just before you begin to run your test. Errors that arise from poor sample collection, poor labeling, things like that, poor preparation, poor identification, inadequate samples. So before we talk about analytical errors, let's try and understand some of the errors that directly affects you as a patient. That you as a patient, if you fail to follow some of the direction given to you by the doctor, then such things will have a great impact on your result. One of these things is the tests such as fasting blood sugars and fasting lipid profile. These are tests that requires you as a patient that you fast for about 9 to 12 hours. So in the morning before you take something, the tests are done, just to ensure that the recent meals that you take does not interfere, does not falsely raises the values of your test or reduces the values. So it is important that you strictly adhere to that as a patient to ensure that you get the accurate results to your doctor. So when you are told that a fasting lipogram, lipid profile, these are the tests that try to check for the levels of fats in your system and helps the doctor to diagnose conditions such as cardiovascular diseases or maybe a heart attack. And then there is fasting blood sugar and random blood sugar. So fasting blood sugar also requires that you fast for about 9 to 12 hours before the test is done. So you as a patient, it's your responsibility to ensure that you do exactly that. You follow the instructions strictly. There's things like recent exercise, or maybe you involve yourself in strenuous activities that requires a lot of movement in your body. Maybe you will sweat and some of the enzymes will release. So when you are from recent exercise, there are some tests that will also be affected in your body. It's like the creatine kinase enzyme, the lactate, the ST enzyme, the liver enzyme. Some of these liver enzyme will be falsely high due to the activity that you are involved in. You have alcohol and smoking. For those who are taking alcohol, those who are smoking, this thing interfere with some of the values, especially the liver enzyme, the blood glucose. So you might not be able to get the accurate value due to these substances. We have stress and anxiety. Such also have a great impact on some of the hormones and maybe enzyme and some values in your body. For example, we have the cortisol. When you are stressed or maybe you have an anxiety, the cortisol levels tend to rise. The glucose, the white blood cells, these things are the things that if the patient involves his or herself in, they have some impact on the values of some of these variables that are tested in the lab. So you need to give out accurate information to help in the test and also in giving you accurate system. We have medication. Some of the medications that you take, they will alter some of these tests in your system. For example, the anticoagulants. Maybe the blood is not able to clot due to the anticoagulants that you have been undertaking. We have time There are tests that are time specific. For example, cortisol. The doctor will request an AM cortisol. Since cortisol tend to rise in the morning, the concentration seems to be high very early in the morning and it reduces in the evening. You have tests such as morning urine that is more concentrated as compared to other random urine samples. So we need to be keen on such and give the accurate information about yourself, things you do, medications that you take, because these things will help the lab tech in interpreting and giving the accurate report. So let's jump into the analytical factors, things that, or some of the errors that might interfere with the accuracy of the result, things that are done during the analytical phase that might end up altering or interfering with the accuracy of the result. Analytical test is where now the test is actually done to produce the results at the end of the process. So we have things like instrument calibration. Before you run any test, you have to ensure that the machine is calibrated and it is up to date, the calibration. To avoid any error when running the test. Things like controls. You must ensure that all controls are passed before you run any test. So that will help you to understand the machine is functioning properly and to rule out faulty in the machine. So you must ensure that all the controls are passed, be it positive, normal or negative controls, all of them must pass. Or if it is high, low and normal, you must ensure that they are all passed before you run any test. You have reagents problem. Ensure that the reagent is not expired, it is not contaminated, or it is not stored improperly. As such, it might interfere with your test as well. Using expired reagents, those are some things that are not recommended. Contaminated reagent, ensure that you store your reagent properly. If it is indicated that the reagent should be refrigerated, then it has to be refrigerated. If it is indicated that the reagent should be stored in a room temperature, maybe up to 26 or 25 degrees, it should be maintained at that temperature to ensure the stability of the reagent even as you run the test. Because if the reagent is not stable, you are automatically going to get a false results or produce an inaccurate results. So such things should be ensured to avoid such errors interfering with our report. We have lipemia. Lipemia, these are fatty samples. Maybe you collect a blood sample and it contains a lot of fats. Such lipemic samples normally interfere with some of the tests, especially the things like the lipid tests. The cholesterol levels tend to rise when you have a lipemic sample. So you have to take note of that and do the required corrective measures when dealing with such a sample. We have hemolysis that might arise during the process of handling the sample. We have clerical work, technician mistake, you pipette the wrong amount of the reagents, you pipette the wrong amount of the sample while doing your test. Such things automatically have a direct impact on the result that you are going to get. So you must ensure that you be keen in each and every step in order to come up with a reliable and accurate result. That is very crucial as a lab professional. And you as a patient also ensure that you provide accurate information about yourself, things that you do medications that you have been taking. If you have taken something, maybe you want to do a fasting blood sugar, you have to be honest, so as we get the accurate report and you'll be given the correct treatment. Thank you, and keep following for more.